Welcome to the Smile Project, a podcast from School of Dentistry, IMU.
Thank you for joining us today. This podcast is all about holistic dental education on the go. This would enhance your knowledge and attitude, not only towards dentistry, but life as a whole.
Tune in to hear and learn from specialists from various fields of dentistry, sharing their experience and discussing topics in the realm of dentistry. Also, we have in store a small dose of inspire and influence, a section for quotes and productivity tips. So, let's begin!
Hi guys, welcome back to another episode of the Smile Project podcast. This time with Dr. Chong a fellow IMU alumni who was a top student, graduated back in 2013, and now a lecturer and an orthodontist. So brace yourself. Braces, brace, get it?
Oh god, Martha, no!
Okay, before jumping into that, I am Martha.
And I am Arna, and we will be your hosts for this episode. Back to Dr. Chong, she was awarded the Tan Sri Dato Amar Sulaiman Merit Award as the top student in her cohort DT108. Her academic excellence granted her a scholarship from IMU to pursue her postgraduate studies in orthodontics at UKM. She completed her postgraduate in 2021 and she now lectures in IMU. With that, allow me to welcome Dr. Chong to share with us her journey and the challenges she faced while specializing.
Thank you, Martha and Aruna. Thank you for the kind introduction. I'm so excited to be here, and I hope that we have a wonderful afternoon together.
Likewise. Thank you, Dr. Chong, for being our guest for this episode on specialization in dentistry. Let's just cut to the chase, Doctor. We all know that there is a multitude of specializations in the dental field, from prosthodontics, periodontics, endodontics, to oral maxillofacial surgery, and many more. May I ask about your journey to specializing in orthodontics? Like how it began and maybe some story or inspiration regarding your choice to specialize in orthodontics.
So truthfully, orthodontics was never in my mind because during undergraduate, I really struggled to do the wire bending, like the Adams class. I have like a whole box full of like rejected ones. And when I was called back to IMU, it was actually for the post of a special needs dentist because I actually enjoyed hospital dentistry. I enjoyed treating geriatric patients and patients with, Down syndrome, autism. It gave me joy to help these people. However, I noted that the program would only start after a few years and I was getting impatient. I really wanted to do my postgraduate studies quick. So I applied for orthodontics and I was very surprised I actually got a seat in UKM, and that's where my journey began.
Pursuing a postgraduate degree it's never easy, and especially I imagine in a course like orthodontics. So could you tell us a bit about the struggles that you endured over the course of your postgraduate studies?
So when you enter a postgraduate program, the expectation of you is much higher and you do need some clinical exposure. So I always advise those who want to undergo postgraduate to work first, then only apply for postgraduate. You will learn much more that way. So I struggled a lot because I have zero exposure in orthodontics except for evening attachments with the orthodontist in IMU. That time was Dr. Sneha. So I used to assist her in doing her patients, but it's very different compared to those from the Ministry of Health. So those from Ministry of Health, they're very hands-on. They actually bond the brackets on the patient's teeth. They do the adjustments. It's different than being an assistant where you just pass the instruments. So I struggled in my clinical because we were expected to know where to put the braces on and what wires to step up to. So it was a lot of reading and going on YouTube and just asking your peers. So I believe clinical exposure is really important.
That's good to know, Doctor. Like, same for us, like dental students. Clinical exposure just really gave us the chance to apply what we know and also like trial and error so that we can improve where we are lacking.
Can I also just ask, what advice would you give to someone who is an aspiring orthodontic student before they actually start their journey?
Right. So, as I said earlier, it would be good to have some clinical exposure. So, if you do go for orthodontic courses, don't believe that it's like wasting your money or something like that, because I think it will help in your education. So, where you select your postgraduate education is important. You need to study the curriculum, see what kind of appliances are being taught to you, because a wider exposure, for example, if you learn about mini screws and different types of brackets, ceramic brackets, self-ligating brackets, the Damon brackets, and all sorts of appliances. It will sort of give you confidence when you finish the program. You have experienced how it is before, the challenges and things like that. So I believe that you do need to do some research before you apply for any postgraduate program.
Can I also just ask, what kind of clinical exposure do you think they should go for? Does working in a government clinic help in that kind of scenario?
Definitely. The government clinics, if you're attached to the orthodontic clinics, they have a lot of patient flows. They see 30 to 50 patients a day, so you actually work on your speed.
That's a high volume.
Yes,
yeah.
It's like you have to see a patient within 5 minutes, and that's why my colleagues in the clinic, they are so quick, and whereas I'm struggling there, I take so long. I'm always the last in the clinic, and they will come and help me out. So I believe seeing a lot of patients and doing things, that will definitely help you a lot.
Practicing more.
Correct. You need to practice a lot.
Totally agree with all those that you said, Doctor. Like, before choosing whatever specialization, they should make an informed decision. So, because they will also need the passion inside them to overcome the unavoidable challenges. So, Dr. Chong, speaking of challenges, may we know what are the most common orthodontics treatment plan, and are there any challenges in them?
Okay, so cases that I often see nowadays are actually relapse cases, because patients do not realize that they need to wear their retainers, and they are kind of disappointed that their teeth are not as before. And it's really difficult to retreat these patients, because previously they had extractions done, so there's no space left for me to correct the crowded teeth. And also, every time you put on the braces, there are risks involved. So, for example, in the first orthodontic treatment, there will be some root resorption. So when we put in another round of treatment, you expect more root resorption. So is it justified to do these braces again? And the patient is much more older now, and they have gone through 2 years of braces, and to start it over again, it's both quite difficult for the patient as well. So these are the challenges I am seeing. So I think we need to educate the public that retainers for life is very important. As long as they want their teeth straight, they need to wear their retainers.
Definitely consistency is key. Like, having a relapse and doing it again is like not wise economically, and also like patient health and so on. Like, they have to go through the same thing again, their trauma maybe, because both of us, Aruna and I, we've did braces before, and I think I'm the relapse patient because I'll be doing it again. So fortunately, I didn't have any first premolar removed that time, so this time I'll be having 4 first premolar removed. So I guess there's more spaces, and the doctor said I'll be having like mini screws as well. So I've learned from my lesson, and I will use retainers for the rest of my life.
I mean, even I sometimes forget to wear my retainers, but I do my best because I definitely don't want to go through the entire process, because it can be quite tedious as well, right? So yeah. Right, moving on. I'm sure all our listeners, they're very familiar with braces and aligners, but what are some of the lesser known appliances that are used in orthodontics?
Okay, so when we tell the patient that they need surgery sometimes because they have underlying skeletal discrepancy, they get a shock. They're like, oh, what? I just want to fix my teeth. Why do I need to surgery, So it does take time for them to process because it's not very common in this region compared to others. But just to let you know, in Malaysia, we are quite advanced in surgical options as well. We can do, CBCT scans and, create some surgical guides so that we can have a precise surgical movement, and we can even plan your surgery into very, very detail. So it's like very safe, and it is cost effective if you go to under the government, and it's usually under a few specialists. So it's like you have a lot of experts if you're doing your case. So I believe that there should be more awareness, because otherwise, if we try to camouflage the teeth with the underlying skeletal, you will not get the best results. Your face will not fit the teeth. Yeah, and we are going beyond the limits of your teeth. So I think this should be known by everyone as well, that there is a surgical option and it could be a better option for you.
Understand. Thank you for that, doctor.
Also, Dr. Chong, I've heard about head braces. Would you like to elaborate on that?
Okay, so the head brace is often used in patients who are young, so they're in the developing stage, so maybe 8 to 10 years old, and it depends on what is the problem, which jaw is the problem. So for example, if they have an underbite where the lower teeth are much ahead of the upper teeth and they have a deficient upper jaw, the head brace would be helpful. Okay, and most of the parents, they are quite alarmed when we tell them about the head brace, because it looks kind of scary. It looks like rods coming out from their mouth, from their skull, but actually it's an external appliance. Okay, so it's quite safe, and we will often give instructions, written and verbal instructions to the patient on how to wear it, and it has been very effective. We have a few patients who have a few student cases ongoing, and we can see a very big and good difference to the child's life. So we actually can reduce the amount of possibility of having to have surgery in future, and this has been shown by research actually.
That's very interesting to know, doctor. So I just also wanted to know, what are the impacts can orthodontics bring, intraorally and generally on health and well-being? Any significant changes or things that we should know of?
I think the first thing that people recognize after a patient undergo orthodontics is the smile. Yeah, so I had patients who first came to me, they would talk to me by covering their mouths. And removing the braces just give them so much confidence. And I even had a patient who were often teased because they had a huge protruding teeth, and after the whole treatment, he's just a happy boy. Yeah, so I think it does bring a lot of changes to people.
That's really nice to hear, doctor, and I mean it must also be very rewarding to see. But I also understand from the patient's perspective, because when I had braces I used to refuse to smile with my teeth out, and when people took pictures. So yeah, I definitely understand. So moving on, doctor, can I just ask, the brand Zenium, it's quite famous nowadays, especially in Malaysia. It's a famous brand of clear aligners. So what is your opinion of these commercial self-applied orthodontic appliances?
Okay, so do-it-yourself orthodontics can be dangerous if it's not being monitored by any professional. I know of some companies where the patients attempt to take their own impression, so they're sent a box with all the impression materials, and then they have to take their own mold.
Oh no.
And yeah, as dental students, you find it so challenging itself to take a patient's.
Yes.
I cannot imagine how accurate it will be for a patient to do it on their own. Okay, so I believe that all these clear aligners, if they are being supervised, being done by trained orthodontists or a trained dentist, it's not a problem. Okay, as long as it's being monitored, and make sure that the patient is dentally fit before any appliances are being put on.
That's a very good advice, doctor. So for those currently having orthodontics, what advice would you have for them besides the basic brush more, no hard foods, no sticky foods? Are there anything else they should know of? Maybe some advice not just on the physical aspect but also the emotional aspect.
You know what? The first thing that came to my mind is brush more.
Except that.
Except that.
Yeah, I mean, seriously, it really frustrates us as orthodontists when we see a very dirty mouth. I believe that you have to, care for your teeth more if you really want something for yourself, because the teeth is so difficult. It's like if you don't clean your teeth well, for me, it feels like the teeth have a bag full of stones, and it's really difficult for it to move. It's so heavy. So try to, keep it clean, and you make everyone's life so much easier. Your gums are healthy. You don't get white marks after you remove the braces. So I think for me, that's the main thing. Just brush your teeth.
Yes, I think that's the only thing they can do also, just brush more. Yeah. And flossing, how about flossing? Do they need like newer, like other appliances more than just the traditional floss? Right,
I believe flossing with your braces is quite taxing. It's not easy to do. So I can imagine, I actually don't put that expectation upon the patient because it's really difficult to do. So I think the water floss is a good idea actually. I do have a water floss at home, even though I don't have braces on. And I think it's a very good investment to buy a water floss when you have braces. A cheaper option, a hack, would be you go to the shower. When you shower, full blast the shower head until you empty.
I thought it was just me.
I was just
I do that all the
time. Put the shower head in front of my face.
Me too.
Okay, now that it
Right.
works.
Okay, so
We're not weird.
We're not weird. Okay. Also, doctor, regarding Martha's question earlier, how would you prepare the patient emotionally for braces, because they can't have a lot of different foods, and also physically they might be very conscious, like I said earlier I was. How do you emotionally prepare someone for that?
Yes, I think most of the time the patient is so excited to get the braces on actually, and when we put them on, they say, "Doctor, when do I take off the braces?" And it was like very irritating question. But yes, before I actually put on the braces during the initial consult, I want to gauge whether is the braces really from the patient's wants or is it the parents. Yeah, so they must really want it because they have to go through a difficult time. So I actually do explain to them. I exaggerate actually. I'll say it's going to be so painful. The first day you want it off. I really make it like sound so terrible. So when actually they get it on, they actually tell me, "Doctor, I don't need the paracetamol. It was fine actually. Only when I eat maybe it'll be a bit tender to bite. Otherwise, it's good, it's cool, And I try to make every visit fun. So, I always offer the colours. Even though I know that this patient always will pick the same colour. I said, I said, okay, why don't you try something else, And it's just some fun things that we do together. And, I can tell them, you can even mix and match. So, as they start to get used to, they will can see that they start to change the different colours and get more confident and brave with it.
I definitely used to do that. I used to always change my colours. I had so much fun with that.
But then on the food side, diet side, I don't think...
Yeah, I couldn't eat like popcorn. I think it used to get stuck in my braces. I was a bit sad. I couldn't have popcorn. I was sad.
Okay, noted, Aruna.
Moving on. Sorry doctor, what are some of the more interesting cases that you've seen?
Interesting cases. All cases are interesting. Okay, it being rare, it's not really rare, but we do have cases where patients come in with fake braces.
Fake braces?
Yeah, fake braces. And even some, because I'm doing treatment for them, and then the siblings get jealous. So they will actually put on fake braces. The siblings will get fake braces, and I have to tell them, no, this is so dangerous. So I had a few occasions where I had to remove those fake braces and re-educate the patient. So I think, and they're actually kind of shocked because when that time I was in the government service, as part of my postgraduate program, so we treat the patient really quite affordable. Like it could be 1,400 only for the whole treatment. So, and they paid for the fake braces about 800. Like my deposit for our braces was even less than that. Yeah, so they were quite shocked. Yeah, they think that braces actually cost a lot, but actually you can get it quite affordable in the different public sectors.
Are they really fake? Like, they don't work at all? Do people just put it on for fun? Like, who even puts them on?
Very good question. Fake braces is usually put on by untrained people. So they may not be in dental background. All they do is they go on YouTube and they watch some videos, and then they go on Shopee, they get the braces.
Oh my god.
Yes. And they have it in hotel rooms or maybe their own houses, but usually not their own houses. They will just rent some house, and they will put advertisement out for people to come in to get the braces on. So most people, they want those braces because it's cheap. It costs them maybe 600, 800. To me, it's not cheap, but it's cheaper than what they see in private clinics. And some of them, they do it as a fashion statement because it does have a social status to it. People with a bit more money is able to get these braces. So whether it works or not, I don't think so it works, because they just stick stuff on your teeth. So there's no, they don't change the wires and things like that. So I don't think so it works.
Is that allowed?
It's definitely not allowed, and it's really harmful for your health actually.
And oral hygiene, right?
Yes, very difficult to clean your teeth.
I can imagine.
Yeah.
Could you elaborate a bit more about how and why it's bad to go to these kind of people?
Yeah, first of all, the infection control is literally zero.
Can imagine.
They don't have a autoclave.
Yeah.
And
nothing sterile.
I don't think they even have saliva ejectors, so it's going to be very
There's a pool. Yeah, okay.
Yeah, you'd probably be spitting in like a bowl or something.
Oh dear.
And you're lying on a bed. Hopefully they change the
sheets.
Yes. Otherwise, you don't know who has come before, and is the glove changed?
Oops.
Oh no.
And they're untrained, that's first of all. So, they may not be able to put the so-called braces on the correct places in your teeth. And the glue that they use, is it safe? So all the products that dentists use, usually it's being regulated. That's why they come in heavy, more costly compared to if you get it off Shopee. Yeah. So.
Thank you, Dr. Chong, for all those information that really provides us with more insight, like even dodgy insights. Orthodontics definitely is a field that has so much more fun than just wires and brackets. I hope that this would clarify our audience's question and allow them to understand orthodontics just a little bit more.
Thank you again, Doctor, for taking time off your busy schedule. And to our listeners, thank you for tuning into the Smile Project podcast. We hope this episode gave you more insight into what it's like to specialize in dentistry. Please like this episode and subscribe to our Spotify and YouTube channels, and follow us on Instagram and Facebook at The Smile Project IMU. See you on the next episode.
Thanks for listening to today's episode of the Smile Project. We hope you enjoyed.
If you would like to help support the podcast, please share it with your family and friends and leave a rating or review. Thank you once again, and I'll see you next time.
Bye!